Every scratch tells a story. Turn the page and you'll see me down. But if you read the next chapter, notice I turned my life around. When I couldn't believe in me, I was lost, didn't want to be found. I saw my scars in the mirror and I turned it around. Here I am in the open, beautiful, unbroken. Can you love me, scars and all? Can you love me, scars and all? I've climbed, I've fallen, been bruised, been hopeless. Can you love me, scars and all? 'Cause I love me, scars and all. Got this scar from habits I couldn't break. That's just on my chest from all of my mistakes. Holes in my heart from people that have gone away, but I'm still here today. I kept my faith and came a breakthrough. I couldn't see a purpose in my life, but when I finally came through, my wounds are healing from the inside.
My name is Lindsay Kent, and I am a member of the Junior Board for Mental Health America of Illinois. I've been a member since 2020, and ever since I have absolutely fallen in love with this organization. I want you guys to take time today to really reflect on the things that are said by our incredible Majority Leader, Greg Harris, and a little bit about me and why I chose to join Mental Health America is because I want to end the stigma around mental health. I want people to be able to understand that it's not something you should be ashamed of, and you can always look forward to fighting for it because you are worth the fight. Other than that, we hope you guys sit back, relax, ask as many questions as you want, and really enjoy your time today. Thank you guys so much, and I'll...
Hello, I'm Ray Connor, and I've been Mental Health America of Illinois board member since 2009 and executive director since 2016. Since 1909, Mental Health America of Illinois volunteers and staff have worked passionately to promote mental health, prevent mental illness, and improve the care and treatment of persons suffering from mental and emotional disorders. Our three main areas of focus are to educate, advocate, and to inform. I joined this organization so I could advocate for support and services for other families like my own. In current times, the public need for adequate mental health services could not be greater. Mental Health America and many other mental health organizations must continue the hard work to ensure that our neighbors, colleagues, family members are never alone in their journey. Your support of our work will help many. Thank you.
I first met Majority Leader Harris when he had decided to run for his current office as a representative from the 13th District. This was an open seat, and the Mental Health Summit, Mental Health America, and the Community Behavioral Healthcare Association, better known as CBA, had decided to have candidate forums around the state in districts where there were contested races for office. And the previous occupant of Representative Harris's seat had decided to step down from her position. And Representative Harris was one of the candidates who I met that very first night. And it was such a pleasure to meet him. Among the many things that I think made him stand out for the audience of mental health advocates, mental health consumers, mental health providers that were in attendance for that candidate forum back in 2005, what was the fact that Representative Harris talked about his own issues with mental health problems, which I think most people have. And it was refreshing to hear his candor about the issues that brought him into public life. Representative Harris, since then, since being elected, has had rapid promotion and is now the majority leader of the Illinois House of Representatives, where he is second in command to the Speaker and has taken a leadership role on so many issues. Of course, he's been a leader on mental health and behavioral health issues and done so much to sponsor and support legislation that has benefited every person with mental health conditions in Illinois. But that's not all he has done. He has been an activist in getting the Illinois marriage equality law passed. He has been helpful in all kinds in violence prevention and a variety of other causes that have made Illinois a better place to live for everyone. And I'm so honored to have Representative Harris, now Leader Harris, join us today for a conversation about mental health. I'll say one more thing about Representative Harris, Leader Harris, and that is that he is one of the foremost experts, if not the expert, on the Medicaid system in Illinois. You may say, why is that important to people with mental illnesses? Well, the truth of the matter is that Medicaid is the single largest funder of mental health services in Illinois and every other state in the country, but particularly in states like Illinois that wisely chose to expand Medicaid when it was possible to do so after the Affordable Care Act was enacted. So that means that a huge percentage of the funding for all of the services provided to people with mental health care comes from Medicaid. And that's crucial to us having a vibrant mental health service system. And it's therefore very important to have an advocate and an expert like Representative Harris. And I would say he has a unique combination of skills. He's smart, he's dedicated, he's wise, and he's thoughtful. And with that, I would just say, let's dive in and have a few questions for the leader. Thank you for joining us, Leader Harris. I guess my first question is, why did you decide to become a member of the Illinois House to run and then get elected to the House?
Oh, first off, I'm going to hire you to be my PR guy, Mark. I mean, that's like the best introduction I've had. That's very gracious. So what got me involved in politics and community organizing initially was the appearance of HIV and AIDS in Chicago in the late 80s, early 90s. And like a lot of other gay men at the time, everyone around me was getting sick and dying, and there was no government support. There were no laws protecting people against discrimination in employment or housing or public accommodations. There were no medical treatments at the time. So a lot of us who never got involved at all before suddenly found that to save our communities, to make government pay attention, make government devote resources. We got involved in organizing and community building, and a lot of the big organizations that exist today, they have their own buildings and staffs of a couple hundred people. We're just a bunch of us sitting around our living rooms or kitchen tables saying, okay, how are we going to get people food? How are we going to be sure people have housing? Where are people going to get health care? Where are they going to get spiritual assistance from a church or a mosque or a synagogue that would minister to them? Legal assistance, all those kind of things we had to create from scratch. And that's how I got involved in this.
Great. So as I suggested, Medicaid is one of the important issues in the state for people with mental illnesses, and of course, lots of other people. And you have been on the forefront of either sponsoring or often participating actively in drafting, or certainly being a co-sponsor of almost every major Medicaid change since you were elected to the House. What do you think is the most important changes we've had, improvements in our Medicaid system that we should be happy or proud about, and you should too?
Well, I think there are a lot, and boy, there are many, and it also really paid off that we made these changes early on and these expansions for folks, because when COVID came, our Medicaid rolls went up by about 1 million people. So there were several million people in Illinois, whose insurance was Medicaid before COVID. Now there's another 1 million. It's up to maybe about a quarter to, somewhere above a quarter of the population of Illinois now gets its health care through Medicaid. So all the work we've done to be sure that we've expanded coverage, to make sure there's parity for mental health and substance abuse treatments with different physical health treatments, to maximize our federal spending. I don't think we could have done a lot of what we did if we had to rely on state resources alone. But we've been very aggressive, and Governor Pritzker's administration has been very aggressive in seeking out ways to maximize federal dollars and bring additional matching dollars in for specific services, particularly mental health and trauma-based care, so we can provide more services to people. But that doesn't mean we're by any way out of the woods. I met with a group called the Rebuild Illinois Mental Health Workforce Coalition yesterday, who are talking about the challenges for mental health providers and clients that are out there. There are 4,000 unfilled jobs in mental health statewide, and people are struggling to find qualified folks who will come in and work. So making sure that we're putting enough extra money into the system so that people can fill their positions, just to not only increase the amount of care, but even to maintain what's being done today. Agencies were talking about having 41% staff turnover in the last year, either as people looked for higher paying jobs or just people who, under the stress of having to provide services while dealing with their own family's issues, just said, we're burned out, we've got to take a break, we can't do this, we're moving on. But there's a huge amount of churn that we've got to address. 1,000 people in Illinois took their own lives in the first 3 quarters of 2020. And boy, if there's nothing else, that just shows how crucial these services are. So I could go down a list, but like Mark, you said, expanding Medicaid not only to cover families with children, but under President Obama, states were given the chance to expand it to unmarried individuals who had not qualified before. Illinois took the broadest expansion, and it's good we did, because now with COVID, there are so many people who are able to get care who otherwise were not able to access it. And let me just add one thing that I'm just really proud we've done for the last 2 years is, because Medicaid is a federal program, people who are undocumented cannot get care through Medicaid. But Illinois has extended to undocumented persons 55 and up over the last 2 years, complete access to the Medicaid program, and we're paying for that all out of state funds. So there's no problem with the federal government, because especially people who live in underserved communities who might also have language and cultural access challenges, we have to be sure we do the outreach and be sure that they get the care they deserve.
So in some sense, you've answered some of this, but what do you think are the next things that we need to do to make Medicaid still better to deal with these problems that have not yet been solved?
Right now, in the short term, it's looking like staffing shortages, making sure that there are enough mental health professionals to fill slots to serve not only the people who are getting services now, and this is everywhere in the state. This is what I learned yesterday from talking to providers from all over the state of Illinois. This isn't a Chicago problem or a suburb problem. It's a problem in Rockford. It's a problem in Bloomington. It's a problem in Metro East. So all over the state. And that means we're going to have to do things earlier in the pipeline also to prepare people for careers in behavioral health. So a lot more early outreach and training in like high schools and also colleges to get people on tracks that will give them the training they need. There's thousands of people on wait lists. But also, we're looking at not only the COVID epidemic, but you're looking at an epidemic of violence going on in the state of Illinois also that has ticked up just as it has in other states. So it's not an Illinois problem or Chicago problem. You're just seeing, the stress and the anxiety and the disparities and the inequities of COVID manifesting themselves in all different kinds of ways, out in the community. And we've got to respond really proactively to that. And we've got to meet people where they are. We can't expect folks who are struggling to, find a provider, get signed up for Medicaid, come in, do the technology if it's a online appointment or virtual appointment. And what we learned from COVID is if we're going to get out, especially in communities where there are just so many challenges, we've got to go meet people where they are with trusted messengers from their own community, with help with technology and help with transportation, whatever it takes to be sure they get into care.
So I would just note that for our viewers and listeners, that in the chat box has been posted a link to the National Suicide Prevention Hotline. Leader Harris mentioned the horrible toll that suicide has taken on our state and every other state. And if you know someone who's at risk, you encourage them to call that number or help them. Additionally, posted in the chat room was a link to the national organization, Mental Health America, where you can get free, anonymous screenings for 9 different mental health conditions, and then they will try to link you to services if you go on that website. One of the other questions in the chat room, and I think I'll just go to it even though I have my own further questions for you, Leader Harris, is what should we be doing to intervene earlier, as you said, with youth? What kinds of things should the state be doing to either with regard to Medicaid or other parts of the state government and local government that you're familiar with?
Well, I mean, that's a huge topic, and that could be, a day-long seminar in and of itself. But, I think just some of the broad overviews of things we need to look at is being sure we're adequately funding services for youth, trying to figure out, where youth might be accessing those services. Maybe it's through a school, maybe it's through a community organization, an after-school programming center, a faith-based institution, a Boys and Girls Club, whatever. But also giving training to folks who work in those facilities on how to identify, where there might be somebody who's struggling or a youth who's undergoing trauma or their family's undergoing trauma, who can help them find somebody who can help, who's appropriate to help them work out those issues. So there's just, a long list, and I'm sure folks on this call are way more conversant in that than I am. So I'll just leave it there, but there's a lot of work to do.
So getting back to things that are more directly related to state government, one of the problems in Illinois, and this is true in every state to some extent, is that we have so many different state agencies that have responsibility for dealing with people with mental illnesses. Of course, we have the Department of Human Services that runs our 7 state psychiatric hospitals and also provides some community funding. We have the Department of Healthcare and Family Services, which, as you know, Leader Harris, is our state Medicaid agency. We have the Department of Public Health, which licenses many of our providers. And unfortunately, we have the Illinois Department of Corrections, which has more people with mental health conditions in its many facilities than are in all the public and private psychiatric hospitals combined. And then, of course, we have state and local governments that often are trying to and succeeding in providing mental health services. But there's a lack of coordination between all of these organizations. And I'm wondering if you have any thoughts about how, whether there's legislation or whether there's some way we can help encourage, perhaps that's the right word, state agencies to work better with each other.
Yeah, and that's always a goal. And so I've been in this job through 4 different governors, and each one has taken a stab at that. And made some improvements. I think Governor Pritzker, when he came in, this was going to be a major focus in all of the human service categories, where it would be mental health, substance abuse, intellectual and developmental disabilities, anti-violence programs, doing some coordination and consolidation. But then, a lot of those plans got derailed when, COVID came along. Nobody had counted on this happening. And the whole focus of us in government and the administration has been keeping people safe, helping out our businesses, providing emergency services, all related to the COVID epidemic. And, as that hopefully we're beginning to see some light at the end of that tunnel, but it's going to consume a lot of time and resources being sure all those needs are met.
To ask a more specific question here, one of the problems is that we do have lots of folks with very serious mental health conditions who are in our state prisons, and almost everyone who goes to state prison eventually gets out. The number of people who stay forever is very small. And when they get out, they have to come back to communities. And at least 30% of the people who are in our state prison system have a serious mental health condition. Would you support, making sure that our Medicaid program requires providers, whether it's managed care providers or local providers, to work with the state prison system so that the prison system tells community providers when people are leaving, and community providers have some obligation to meet them at the door or meet them soon after, so that we can actually make sure that people don't just immediately deteriorate because their mental health condition is not treated when they leave a prison.
Yes, so somebody was unmuted and there was some background, so I think I got your question. But it's about people returning from Department of Corrections. And yeah, this is something that we could just not do enough about. I mean, if people come back into their communities and into their homes and nothing changes for them for the better, and it's just not good for them. It's not good for the communities they live in. You can't expect people to come back into exactly the same life and lifestyle they led before with no supports and really be successful. So we've done a lot of things. I had a bill a number of years ago that required Department of Corrections to work with Medicaid department to begin the eligibility determination process in sufficient time. When somebody was going to be released, they would have to be given advance counseling and sign up so that when they walked out the door of the correctional facility, they'd have Medicaid eligibility. Also, to be sure that they had quantities of their different prescriptions, so that between the time somebody left Department of Corrections and returned home, that they wouldn't have to be struggling, like how do you get the next couple of weeks worth of medication, making sure people have proper identification and legal IDs and that kind of thing. A lot of assistance. As I sit and listen to people who have recently come out, you've got a whole group of folks for whom technology and cell phones are not something they've been familiar with. So saying, well, just go online and find a agency in your community who accepts Medicaid. If you've not had familiarization with an iPhone or computer or iPad, Android, that kind of thing, just helping people get those skills, and in the meantime getting them connected are important. And yeah, there's a lot of work to be done there. And Lieutenant Governor Stratton, Juliana Stratton, has made this a real focus of her work and is doing a lot to coordinate a lot of these different activities, which is good, so that you're getting some central coordination and not as divided a response.
Well, one of the other things that people leaving prisons face, and also people leaving jails, and people who end up in our state psychiatric hospitals, is the serious problem of homelessness. That is, so many people being housing insecure, either not having a place to live or being couch surfing, being at imminent risk of losing your housing, is a serious risk factor for people who already have mental health conditions or are at risk of having their mental health condition worsen. Part of the problem, as you know, is that housing is extremely expensive. Is there some way to identify funding so that we can get supportive housing for people who are most at risk of going back into institutions or even ending up in the criminal justice system, which is not only bad for them, but bad for us?
One of the things we're doing, you're probably aware that Congress and President Biden had the American Rescue Plan Act. People call it ARPA, that's its abbreviations. And it gave states several $billions to spend over the next 4 years on things related, one-time kind of expenses that would ameliorate problems caused by the pandemic. And one of the things we're using some of our money in Illinois on is exactly what you're talking about, is creating affordable housing and making sure there are affordable housing opportunities. We're putting several $100 million into it starting last May. We're Will Guzzardi, who's chair of our housing committee, is holding hearings right now with homeless providers and supportive housing providers to figure out what our next tranche of that will be for next year. And we're trying to build the capacity. I mean, this is money we're going to have once. You can't build a cliff for providers. But can we construct thousands of units of affordable housing? We've worked with Lawndale Christian Development Organization and United Power for Action and Justice, and they're working with the city of Chicago and the state, and they're going to create several thousand new affordable single family homes on the south and west sides using some of this money. So there are a lot of ways that we're looking at doing just what you're talking about.
I would like to shift gears a little bit and talk a little bit about politics with a small p, which is to say civic involvement in politics. And as you know, one of the things that affects how laws get passed, how policies get changed, is the extent to which people are complaining about them and communicating. One in 5 persons in Illinois or any other state has a mental health condition. But I think we haven't been a loud enough voice to speak to and encourage people who are supporters like you, but perhaps people who need some conversion, who have not been so supportive, and to make sure that among the too many needs that Illinois faces, that mental health needs are a higher priority. What should mental health advocates and providers and consumers be doing that they haven't been doing to sort of help you do your job and get laws passed that will help all of us?
Well, speak up and talk to your senator or representative. I mean, that's just so important. The number of people who are in contact with us lobbying on different issues right now has just plummeted since COVID came along. A lot of that is due to just the fact you can't do in-person things. We're not having town halls as much as we would like to because of different transmission issues. But just also people are so overwhelmed that they've got way more things to do than writing letters or emails or calling reps and senators. So if you do it right now, you have an outsized voice because so many people aren't. The other thing we found, though, is we've slowly started to venture back into some in-person meetings, is people are hungry to participate and let their voices be told. Even when we do things on Zoom, in years prior, we might have 50 people at a community town hall. Now we'll have hundreds. So there's a lot of interest out there, but you got to speak up. And as we make these funding decisions, and I can speak a little bit about this because one of my jobs is I'm the lead budget negotiator for the House Democrats, is there are a lot of needs and none of them are unimportant, and they're serious, but we have to make choices. And it's really true that when it gets down to the time to choose, there's this many resources and there's this much need. who has the, who has been very active in making sure their voice is heard is going to get way better consideration than people who have been silent. So making sure that every representative or every senator who comes in to see me or the speaker or the Senate president or whatever says, look, we know we got to do a whole bunch of different things this year, but our top 2 or 3, one of them's got to be mental health. I mean, that's the message. You don't have to come in and say, this is all we're focusing on is mental health, but you've got to be able to come in and say, this is really at the top of our list of needs.
In the chat box, we got a question that follows up on the issues relating to staffing shortages from someone who is a recent graduate with a master's degree in clinical mental health counseling. And she is concerned about the great deal of debt that people getting advanced degrees in the mental health field often end up burdened with. And that, of course, may encourage them to take jobs not helping poor people, but helping people who are better off, or taking jobs out of the mental health field completely. Is there something that we could or should be doing to deal with the debt burden that affects people who want to be in the mental health field, but end up either can't afford it and therefore don't join or finish, or end up having to leave the field because of the debt?
Yeah, and that's a real concern we hear like a lot, and there's different ideas out there on how to address it. One, raising wages and compensation, or which means also raising rates to providers so that they can pay at higher rates to compete with an MCO or an insurance company or whoever else might be trying to hire away workers. Or do you create a program where there's debt forgiveness if you work in an underserved community for X period of time, or that kind of thing. So there are a number of ideas on the table. We're just trying to figure out what is the best use of the money we have and which would be the most effective. So if people on the call have any thoughts on that, it's certainly something we're talking about. And I'm going to put my email.
I think someone already put your email in the.
They put my web address, but that's my email there. So feel free if you have some thoughts on what that might look like on the debt side, let me know.
Thank you so much. That'd be helpful. So one of the other things that you touched on earlier is the horrible rate of suicide and in this state and across the country. And we have an excessive rate of suicide among veterans. We have an excessive rate of suicide even among police officers, because it is a very difficult job to be a police officer these days. What should Illinois be doing on the suicide front? Do you have some thoughts about that?
Yeah, and as part of the budget we passed in May, we put aside special new funding for trauma-informed care for young people, to be sure that there are resources out there to help youth in distress, but also first responders, because this is something we heard, just from all angles, is people on the front lines, where you're a police officer, firefighter, EMT, paramedic, the people who are out dealing with a lot of these in-person contacts during this time had really dire mental health needs. So we're also trying to reach out particularly to them.
Great. So among the things that you probably know is that in fact more people who die by gun violence die by suicide than by homicide. That in fact, guns are more apt to be used by people to kill themselves than to kill someone else. Of course, both of those are horrible events. But I'm wondering whether there are anything we can do about in this contentious time to help protect people from using guns to commit suicide.
Yeah, I'm sure there are, and we've, Illinois has sort of been a leader in a lot of the different gun control in general items. I know the governor just published a report, and I haven't gotten to the part about suicide, but that talks about and maybe somebody can find that and put that in the chat too, on violence prevention, a statewide violence prevention writ large. It was just released in the last, couple weeks or month. And it talks about all kinds of violence. It talks about gun violence. It talks about street violence. It talks about domestic violence and abuse. And it also talks about suicide. And it lays out for each of those areas some prescriptions. This is put together by groups of people statewide. So there is information out there, but I've just not read that part yet. But something to look at.
So as we mentioned earlier, there are too many people with mental illnesses in our criminal justice system who end up in prison and jails. We happen to be lucky to have some leadership on our Supreme Court, which has created a special committee on mentally ill people in the criminal justice system, and they just issued a report. You probably haven't had a chance to read it, but among the things that they say is that that there are lots of tested programs for diverting folks who are in the criminal justice system or keeping people out of the criminal justice system. But of course, the court system doesn't have funding to pay for services. And I'm wondering whether this should be a priority of our mental health funding streams to with our court system to divert people out of the criminal justice system, which jails and prisons are among the worst places for people with mental illnesses to end up in.
Yeah, and I think that's something, again, that we're trying to focus on, trying to bring back attention to, as the day-to-day COVID needs become less pressing. I think we're trying to shift back now into addressing a lot of these longer term issues, and that's definitely one. That's definitely one.
And what do you see as being the legislators' top issues in this coming year, if you can use your crystal ball?
I think, COVID, public safety. I think continuing to strengthen Illinois financially. A lot of the reason that we haven't been able to do as many things as we wanted to do, whether it was about violence prevention or childcare or seniors or whatever, is because Illinois has been broke for so many years. But this year, we've made a huge turnaround in that. We paid down $3 billion of our debt. Our backlog of bills is down from 17 billion to under 3 billion, which is like a 30-day cycle. So vendors, are willing to provide services to us again. We closed about $750 million in corporate tax loopholes so that we had money to invest in new things like mental health and childcare and those kind of things. And I think making sure that we stay on that path of being fiscally responsible, managing our money well so that we have funds to spend on these new items is going to be a top thing for us.
Great. And just to note, Leader Harris mentioned the governor's orders about gun violence, and a link to that has been posted in the chat box for those people who want to look further at that report from our governor on gun violence, which I think is a crucial issue for people with mental health conditions for the reasons we've already talked about. So one of the ongoing problems is in Illinois is that we have always had a substantially larger number of people with mental health conditions who end up in nursing homes, and often for a variety of reasons, not necessarily anyone's particular fault. They don't get great care in nursing homes because nursing homes often don't have the resources to do this. What can we do to help reduce the number of people with mental illnesses in nursing homes, or to improve services in nursing homes for folks who need to be there if they do?
Well, I think, to keep people out of nursing homes, being sure that there's adequate community-based care, and that there's also, you talked a little bit earlier, Mark, about supportive living and affordable housing options so that people can afford to stay in the community. They'll have the services wrapped around them if they need additional services to stay and live successfully in the community. And that would be everything from mental health services and therapy to medication management, activities of daily living. all those things, where sometimes people end up in a nursing home because that's the only place they can get those services.
So I've asked you a lot of questions. I wonder if there's something that you think that you would like to share with our audience in general about what they should know about what the legislature is doing, or what the government is doing in Illinois, or how we can work with you better to help make the mental health system better than it is.
Yeah, I just say elevate and spotlight the issue. I mean, we're having a very short legislative session this year. Typically, we would end at midnight, May 31st, and that's when we would pass the budget for the next fiscal year in Illinois. This year, we're ending on April 8th, so things are going to be, it's going to be 6 months shorter, or I'm sorry, 6 weeks shorter, 6 weeks shorter this year. So if you have work to do, if you want to emphasize, funding for mental health, more progressive policies for mental health, investing in affordable housing, supportive housing, any of these things, your window to get that message to the governor and legislators is essentially, New Year's Eve day until I'd say, about the 1st of April. We'll pass a budget sometime in April, but a lot of the details are worked out, long before the thing finally passes on the floor. So get in there early, early and often. Get in there early, get in there often. Make sure that when all the members come into the room to talk about the budget with me and the speaker, they're saying among the top things we got to do this year has got to be more investment in mental health.
Great. So we have another post in the chat that I would like to relate to you. Depression is the #1 disability in the nation. How can we work with the Illinois State Board of Education to require mental health education in high schools? There's currently social emotional learning courses, but no access to mental health literacy in required health courses. Do you have any advice about how to begin this process?
So I think Rebecca's question is about, are you talking, and you can answer in the chat, are you talking about as part of the curriculum?
Yes.
Yes, okay.
Curriculum. Rebecca's concerned that there isn't enough mental health in the healthcare curriculum.
Okay, and most of the curriculum decisions in Illinois about what's taught in different schools are local decisions made by the school boards. So, I don't know which municipality or school district you live in, but my first stop would be go to your local school district and bring that issue up with them, that this is something that needs to be added in. Sometimes the state does mandate to every school district in the state to do X, Y, or Z, but those are huge, all kinds of political impediments toward state mandates for school curriculum. So I'd start at your local school district.
School districts don't like to be told what to do.
Well, people don't like, there's a big, just state mandates for local school districts is just a politically complicated issue regardless of the subject matter.
Well, we are coming to the end of our time, and I would like to thank you, Leader Harris, for spending this time with us. I think everyone in the audience, if they didn't know this before this hour started, certainly understands your commitment to work with us to make the mental health system in Illinois better, what you have done already and what you are working to do in the future. I want to reiterate what Leader Harris has said. The number of people who go and visit their state representatives is very small. I have never heard of a representative or a state senator in Illinois who will refuse to meet with constituents. Of course, they're busy, and you may have to schedule it sometime in advance. But they are eager to hear from their constituents. They know that you get to vote, and they want to hear from you for that reason, and because they know that you know many areas of expertise that they don't know. They don't know exactly what's happening in your community always unless you tell them. And there are so many different ways you can communicate to a state representative or a state senator. Yes, if you have the time and you are willing to do so, you or a group of your friends can go and meet with a state representative or a state senator. The easiest place to do that is in their district office. You can also meet with them in Springfield when they're in session, but that's a time when they're very busy and it's a little harder to do that.
Let me just interrupt right now. Because of COVID protocols, you cannot come down to Springfield and just walk in. So I would not do that.
Not do that yet.
But I'll tell you one thing, I talk to more constituents now on Facebook Messenger than just about any other place. So there's social media too.
Yeah, so there's social media. You can send people letters. You can call the office and say, please vote for this bill or vote against that bill or something in more detail. You can send emails to the representatives. Representative Harris, Leader Harris has put his email in the chat box. But you can find all this information for most people on the Illinois General Assembly website, www.ilga.gov. Has lots of contact information, the phone numbers, sometimes this is old-fashioned fax numbers, sometimes email addresses, and of course, as the leader said, there are lots of newer mechanisms through which you can contact people through social media.
And could I just throw one thing in here also, Mark? Yeah, please, please, please. I'm glad everyone has my Twitter and my email, but be sure you contact your representatives. I love to hear from my constituents, and as much as I like the people of Rockford or Bloomington or Urbana, the people I'm going to respond to are people who live in my district. So be sure you contact your rep. That'll have way more of an impact.
Yes, so we have posted the ILGA website in the chat room. And if you go on the ILGA website, one of the things you can do is you can there's a link there, you can plug in your address and it will tell you who your state representative is, who your state senator is, and it will give you, and then we'll link to their page on the website so you can find out their contact information. So the person who you can have most influence over is in fact the two people that you get to vote for, your state representative and your state senator. And if you don't know who they are, shame on you, but you can find out. And you can find out easily. The State Board of Education, State Board of Elections has this website where you can also plug in your address and easily find out who your state representative, your state senator. It also tells you who your congressperson is and some other elected officials. So that's a very easy way to find out. And as Leader Harris said, that's the person who you should be communicating with, because that's the person who is supposed to be representing you. Leader Harris has a leadership role, but he isn't your representative unless you live in the 13th district. And so it's very helpful if you'll contact your own representative, particularly if we are lucky to have in Illinois greater and greater interest in mental health issues. Recently, for the first time, we now have both a House Mental Health Committee and a Senate Mental Health Committee. And the people who are on that committee, both Republicans and Democrats, are interested in mental health issues. And that's another forum for you to communicate your concerns, because they hear all the legislation that relates, most of the legislation that relates to mental health issues. And therefore they're knowledgeable. These are the people in the legislature that care about mental health issues, are often have gotten themselves appointed to that committee or to the Human Services Committee, or as Leader Harris to the Appropriations for Human Services Committee. Those are folks who care about our issues. Every member of those committees gets to vote on every mental health bill before it goes to the full House or the full Senate. And therefore, it's important to communicate your views to them. And again, you don't have to go in person. You can, if you have the time to do that, that's wonderful. But you can easily call, write, email, etc. And I encourage everyone to do that. The only way we are going to be the loudest voice in the room, which is our goal, is to communicate, as Leader Harris has said. So again, as we finish our time, I would like to thank you so much, Leader Harris, for joining us today. I would like to thank all of the people who took time out to join us and to listen to you and to understand what is going on in Illinois and how we can make things better. You want to say a final word, Leader Harris?
No, I just want to thank everyone for watching me on Zoom for an hour at lunchtime. I think that's a big commitment, and hopefully we can do a lot of good stuff this year for people struggling with mental health issues all across our state.
Thank you all.
Thank you so much, Leader Harris. Thank you, Mark. Thank you, everyone, for attending. Please do, I put a link. You can sign up for our newsletter and stay engaged with us. Go to our website as well. This is MHAI.org. If you feel so moved and want to continue your support of our monthly educational programs, you can make a donation at our site as well. We are a nonprofit organization. And stay tuned. We have another event coming up, our final event this calendar year in early December, and we'll be sending out information on that soon. So again, thank you very much. Leader Harris, you were wonderful and inspiring, because at a time like this, I've been a political junkie my whole life, but lately I've even had to tune out. The light is dimming. I'm losing faith, but I feel re-energized. So I certainly appreciate all of your words of encouragement and engagement today. Thank you so much.
Thank you.
All right. Thanks, everyone. Have a wonderful day.
Every scratch tells a story.